Let's talk about piriformis syndrome, what it is, and I want to give you some different ideas on how to help yourself because I do see a lot of the same exercise videos, which are all really great. But if you're someone who has stretched and done all the exercises that you think you should be doing and you're still having pain, I just want to give you another idea and educate you on what else could be happening. So the piriformis usually will cause people pain in their butt. That's what my patients come in and tell me. I have pain in my butt, and they're pointing back to their butt. They're usually pointing right near their sacrum because that's where it attaches. And then it also, so it basically attaches onto the sacrum, and then it attaches into the front femur, your leg bone, but in the hip so that it can external rotate the hip. And then when it contracts, it'll cause the hip to go out. So what happens is, people have pain in their butt possibly, or pain like at their SI joint, right? So your SI joint is here. So if this is pulling, then it can cause pain and irritation here as well. Or it can cause something called like sciatica down the leg, because if that muscle is tight, a lot of times it overlays the nerve that travels down and under into the leg. The nerve can sometimes exit on top of the muscle. It can exit underneath the muscle so that if it's tight, it's compressing it, or actually sometimes it'll even puncture through the muscle. That's for like 15% of people that happens. But even still, if you have that type of anatomy where the nerve pierces the muscle, you can still figure out ways that this won't cause you pain for the rest of your life. So let's talk about different reasons. So, the figure 4 stretch is great for this. This is the one I see most often. You're here, let's say it's your left piriformis, so I cross my left leg over my right knee, and I sit up nice and tall. You can do this laying down, you can do it seated, you can do it in a chair, however's comfortable for you. This may even be way too much movement for most people, so you can start here, start further out, and then work your way up. You can give yourself more tension by pushing out on the knee. You can try different angles, so rolling over to the right, rolling over to the left, and seeing where you find the most tension and stretching that way. So this does relieve pain for a lot of people. This is a great stretch. And then let's say this doesn't relieve that much pain, then I would say try to move on to strengthening it. And there are other ways you can stretch it, or you can release this with like a hypervolt massage gun. But let's say you've tried those things. So then you want to try to strengthen it, because sometimes having an unstable pelvis or an unstable muscle can cause this pain too, right? So a lot of times when someone's having this piriformis specific pain, often I see that their glutes actually aren't firing well, and they have an unstable pelvis in general. So you may want to find, what I would say, this goes for SI joint pain in general as well. So it's not just specific to piriformis. Let's say you are trying to move, you're working out, you're squatting, you're having a lot of pain there. Try either having a partner, a friend, or you can grab a belt or an SI joint belt and wrap it around your pelvis. So here are your hip bones, right? Then you want to have the belt. Most belts go in a little belt loop, right? But you want it to squeeze in on the ilium to give it some support so that you're kind of closing up this joint in the back, because sometimes this can get too loose. So then retry your movement. If that feels better, you most likely have an unstable pelvis. So you want to start strengthening the area to help the piriformis. So a few things you can do are glute bridges. I'll show you that real quick so you make sure you have the proper form. So you want to get on your back. You want to press your low back into the floor, and you want to engage your abs. I like to have something in between my legs, typically like a towel or something, so you can squeeze, because you also want to squeeze in on your adductors. Usually I like about a fist width in between my knees, and then you squeeze the glutes and you roll up.
And you really want to feel that effort in through the glutes. You don't want to overextend because then you're just going into the back. A lot of people, I would say, do this incorrectly because they have their feet too far away from their butt and they're trying to use their hamstrings. So a lot of times that tells me if someone naturally wants to have their legs further out, that maybe their glutes are weak. So then you want to bring your feet closer to your body and then bridge up that way. You want to feel this engaging. Let's say you don't feel that engaging. You can try this way. Put your feet into a butterfly position, legs out, squeeze everything like I just said before. So you squeeze your abs, press your low back into the ground, and then raise up. And lower, and raise up. And you should feel the glutes engage. Another way to do this is going prone, face down. And you can have your neck in line with your spine. So I'd put your head like this. Then you put your foot or your leg at 90-90. And then you just press up. Press up and hold. If you feel too much pain in your low back with this, try to raise the other leg up too. And you can try both sides. You don't want to, I wouldn't do it together because you're going to load your low back too much, but just lift up one at a time. Once again, if that causes you a lot of pain, try to put that SI joint belt or a belt wrapped around your pelvis and see if that takes away the pain, because then you know you do have an unstable pelvis. And I see this a lot with like pregnant women as well when they have a lot of relaxin in their systems, which would cause everything to kind of go lax, right? So this is a great one too for that piriformis. And then let's say you've done all the stretching, all the strengthening you think you can do, you've given this a fair amount of time, then you want to consider that a chemical stressor could be causing your piriformis to be weak or overactive. This happens because chemicals in our body can cause inflammation in places, right? And so then that can cause inflammation at the nerve root and then cause what we call like aberrant, abnormal nerve flow. And then the muscle can shut on and off, which would also cause instability in the pelvis. I'll talk more about this in the next segment of this video. So just keep that in mind, that the next things we talk about, it may not be exactly pertaining to you, but just keep an open mind, because I do see this really often, especially with females, because it has to a lot of times deal with hormone imbalances, and that's why their piriformis will never relax or get stronger, in addition to the other external rotators of the hip. So we'll talk about that in the next segment.